This is a community analysis presentation on Plant City, Florida by Melissa Moresi in the Bachelor's of Science in Nursing program at St. Petersburg College. This is a slide of the objectives included in this presentation. Plant City was originally the small Native American village of Ichipuksasa. The original spelling of the name was controversial, so when European settlers infiltrated the area in the mid-1800s, they renamed it Cork. Travel from the port of Tampa to Plant City would take over 2 days by horse and buggy, so a faster method of travel was desired. By 1884, Henry B. Plant funded the development of 2 railroads that ran through Plant City. These railroads boosted Plant City's economy because trade between Tampa and Orlando was much faster. Plant City was incorporated in 1885 and named after Henry B. Plant. Plant City originally received revenue through the sale of local citrus crops. However, a hard freeze killed most crops in 1894. Strawberries were the only crop that survived. They were then planted heavily in the Plant City area and were the main source of revenue at that point. Today, strawberries are still the main agricultural crop, and Plant City is known as the winter strawberry capital of the world. An annual festival was established in honor of the important strawberry crop that convenes to this day. Although railroad was initially the best means of transportation through Plant City, Interstate 4 is now the best means of travel between Tampa and Orlando. Here is a mural when it was first painted in 2010. It commemorates the history of Plant City. This mural is located in downtown Plant City on Collins Street. It depicts the 3 historic places in Plant City: the old Plant City High School, the Strawberry Festival grounds, and the Union Station Depot. Also pictured here are prominent historic individuals of Plant City: a statue, benches, and a water fountain. This is a picture of that same mural in 2015. Construction seems to be in process. Community structure. The city of Plant City is a geographically small area of only 28 square miles. Because of its small size, the community has fewer resources compared to larger cities such as Tampa. An example of an area for improvement would be public transportation. There is no public bus system within Plant City. Residents of the city must travel by car if traveling within city limits. In contrast, the Hillsborough Area Regional Transit Authority, or HART, is an inner-city bus system servicing the Tampa area. Interestingly, HART services distant areas such as Apollo Beach and Brandon, yet it does not service Plant City. It would be beneficial for Plant City's economy and growth for an inner-city busing system to be in place, as residents would not have to rely on the expense of owning a vehicle. The strength of Plant City is its abundance of city parks. The Plant City Recreation and Parks Department has been active over recent years in developing public parks and beautifying the city. Because Plant City is smaller than Tampa, its larger city counterpart, it has less physical space to attempt to beautify. The downtown area of Plant City is especially charming and well maintained, as are most other parks within the area. Another positive, being a physically small area, is that the police department is sufficient for the area. The city of Tampa is 113 square miles, which is around 4 times the size of Plant City, with around 1,000 uniformed officers. The city of Plant City has around 100 officers servicing the area and is almost 100 square miles smaller than Tampa. Educational resources in Plant City include public schools and Bruton Memorial Public Library. Bruton Memorial Public Library is located in downtown Plant City. This is the only public library in the city. Bruton Memorial Public Library had 107,142 items in circulation in 2011. In comparison, the Tampa Library System had 507,407 items in circulation in 2013. This shows that Bruton Memorial Library is a much smaller facility and holds fewer resources than the neighboring larger city of Tampa. Plant City has 23 kindergarten through 12th grade schools, 14 elementary schools, 6 middle schools, and 3 high schools. There is also one community college campus in Plant City, which is Hillsborough Community College. The nearest university to Plant City is University of South Florida, which offers a variety of programs including bachelor's and graduate programs. Hillsborough Community College in Plant City only offers 2-year associate degrees. This is a picture of the public library in Plant City. The Hispanic ethnic group make up about 28.8% of the population in Plant City. In comparison, the Hispanic ethnic group make up 22.5% of Florida's total population. This means that the Hispanic population in Plant City is greater than the average Hispanic population of Florida as a whole. Interestingly, the percentage of Hispanic-owned businesses in Plant City is less than Florida as a whole. With Plant City having above average amount of Hispanic people but a below average amount of Hispanic people owning businesses, there is an inconsistency in employment for this ethnic group. Plant City is known for its strawberry crop and Hispanic seasonal migrant workers employed by farmers. Many Hispanic seasonal farm workers are not legal residents of the United States and do not participate in the U.S. Census. In this case, the percentage of Hispanics in Plant City could be even higher. Another population issue is Plant City's above average percentage of people below poverty level. Only 12.4% of population in Florida are below poverty level, while 15.3% of Plant City population are below poverty level. Unfortunately, foreign-born Hispanics typically have less education, which places them in careers that make less money. Also, only 11.1% of Plant City residents hold a bachelor's degree, while 14.3% of Florida residents hold a bachelor's degree. The percent of people in Plant City with higher education is lower than Florida's average. This discrepancy could be due to the lack of universities in Plant City. Residents must travel over 20 miles to Tampa to attend a university, and the lack of public transportation within Plant City compounds the issue. Pictured here are a group of farm workers employed in a strawberry field. Plant City has an unusually low percentage of elderly, only 11.5%. The entire state of Florida's elderly population is 17.3%. This data defies recent trends of rural communities. According to Jones et al., rural populations of the United States have an increasing number of elderly who are flocking to non-metropolitan areas. Plant City is relatively rural. The community has an above-average percentage of young people under the age of 18, 28.3%. The entire state of Florida's population under 18 is 21.3%. This data also defies evidence-based research stating that young populations are dwindling in rural areas. Jones et al. States that many younger foreign-born Hispanics are gathering in non-metropolitan areas, reversing traditional roles of many elderly and fewer younger populations. Many Hispanic immigrants are fertile young people who have families and have children. This would explain why there are more young people in Plant City today. Plant City is filled with elderly health care resources. Oracle Home Health Care is a comprehensive elderly care business which provides at-home as well as facility-based elderly resources such as hospice care. Heritage Assisted Living Facility of Plant City is the largest of many assisted living facilities. South Florida Baptist Hospital is the local hospital in central Plant City. This hospital provides basic emergency care, but more complicated patients are referred to distant hospitals. Baker Act patients are not accepted. Mental health resources are not prevalent in Plant City. Unfortunately, the nearest mental health provider is in Tampa at Grace Point Mental Health Care. Grace Point offers a 24-hour mental health crisis team that will travel anywhere in Hillsborough County, including Plant City. Grace Point also offers affordable housing for those with a mental health diagnosis at Brewers Bridgeway Apartments in Plant City. According to Jones et al., specialized medical services are less prevalent in rural areas because they are not cost-effective and there are fewer younger working-age people. This is true for Plant City as there are few services for complicated medical patients and no ambulatory surgical centers. This is a picture of Plant City's hospital. Plant City has a large amount of people below the poverty level meaning that these people qualify for financial medical assistance through Medicaid. Therefore, those who are financially disadvantaged are still able to afford basic health care. Of previously stated healthcare resources, all except Medicare and Medicaid in most private insurance plans. Residents who have a more complicated diagnosis, such as cancer, are less fortunate and will need to travel to a larger city for care. This will require extra time and travel, incurring extra costs for the patient. A large number of Plant City residents will simply not seek out medical care due to fear of losing their job. These people are usually Hispanic farm workers and incur job-related injuries. There are 3 Healthy People 2020 objectives that are applicable to Plant City. Plant City should be able to reduce the proportion of persons who are unable to obtain or delay in obtaining necessary medical care. To do this, healthcare needs of all population groups need to be addressed. The unfortunate healthcare access disparity for Hispanic migrant workers is partly responsible for inadequacies in obtaining necessary medical care. Plant City should also be able to reduce the proportion of persons who are unable to obtain or delay in obtaining necessary dental care. There are plenty of dental offices in Plant City. Cost of services could be a barrier to dental care because the insurances do not cover dental care. Finally, Plant City should be able to reduce the proportion of adults with documented diagnosis of arthritis who report psychological issues. In order to accomplish this, more psychological services should be provided within the already prevalent elderly services in the community. Partnerships with distant mental health care services would be needed. Every human being reserves the right to live in a healthy environment conducive to their well-being. Plant City provides water, electricity, and waste disposal for its residents for a monthly fee. Plant City's environment is relatively healthy, however there are issues concerning the water quality of Plant City. One well within Plant City was found to have contaminant resources, located within the Plant City industrial area. The Plant City industrial area is also considered a brownfield area, which means that it is a contaminated environment that is complicated to clean up and is designated by the Plant City government. One such brownfield area is now a community park. A possible contaminant in the Plant City water supply is lead. Lead can be excreted from pipes that send water throughout the city. The city of Plant City takes no responsibility for the materials and piping makeup. The maximum level of lead in water supply in which there is no known health risk is 0 parts per billion. However, the action level that triggers a need for water treatment is 15 parts per billion. This action level is not realistic because any amount of lead has neurotoxic effects. Yet the need for action to clean up the lead is extremely high, set at 15 parts per billion. Lead was found at 2.8 parts per billion in one sampling site between July and August of 2011. This is a picture of Village Green Park that opened in 2015. This park was previously a Midtown brownfield area, but has since been redeveloped. The Plant City budget for 2014 to 2015 fiscal year is balanced. The largest expenditure by far is personnel services. This year, all city employees received a 5% pay increase. With city personnel being the largest expenditure already, the author believes that funds would be better spent in other areas such as public transportation. The Plant City Commissioners are all elected by Plant City residents, serving 3-year terms. There are 5 total commissioners. Every year, one of the commissioners is appointed by other commissioners to serve as mayor, and the same happens for vice mayor. Each commissioner serves on regional boards for Hillsborough County, which enables Plant City to be involved in large-scale community issues. Commissioners can be emailed or called if a community member needs to address any issues. The city manager is responsible for financial issues and also draws up the community budget. He is appointed by other commissioners. The city attorney is the only official who is not appointed or elected by anyone in the community. This is concerning because attorneys usually have a major impact on community policy and lawmaking. The city clerk acts as city historian and record holder and is appointed by the commissioners. On the next 2 slides, there are 6 community issues that need to be addressed in order of the most important to least important. 1. Lead needs to be eliminated as much as possible from the public water supply. Lead exposure in infants and children can cause delays in physical and motor development, as well as attention and learning disorders. This is the most important community issue because lead exposure can cause direct and long-lasting health effects in the community. Everyone needs safe, clean drinking water. 2. A healthcare disparity exists in access to healthcare for Hispanic migrant farm workers. In order to reach Healthy People 2020 objectives of increasing healthcare access for all, Hispanic migrant farm workers need to be represented in the population and not fear job loss in lieu of healthcare. This is second most important because accurate assessment of population data cannot be gathered if Hispanic migrant workers are not represented in the community. 3. Public transportation needs revamping. An intercity busing system or Amtrak station would greatly benefit Plant City. There are currently no forms of public transportation within the city. In order for any other community improvements to be made, access to resources must be available. 4. Brownfield areas need to be addressed. These areas are environmentally hazardous areas requiring funding from the government or private sectors to boost the area's economy. Other economic developments cannot be made unless these hazardous areas are first addressed. 5. Currently, there is not a Plant City homeless shelter. Creation of a homeless shelter would prevent unnecessary illness and deaths related to environmental exposure and would provide resources for the financially disadvantaged. This must be done to move the homeless off the streets. 6. Mental health care resources in Plant City are all from outside areas. A local mental health clinic would help in suicide prevention, which is a completely preventable death. Lead has been found to have negative effects on the nervous systems of humans, especially in young children and fetuses. Lead is common in drinking water in the United States and is usually excreted by water piping in homes and throughout the city. The City of Plant City Utilities Department recommends running tap water for 30 seconds to 2 minutes prior to use, especially first thing in the morning, to reduce lead exposure. Another chemical, polyphosphate, is added to the Plant City water supply in efforts to reduce acidic decomposition of piping and in turn reduce lead corrosion from the pipes. Other countries with lead exposure due to water piping include the United Kingdom, Germany, and Austria. In Germany, a lead exposure prevention program was initiated. Free screening for lead in household tap water was targeted toward families with young children and offered through public health departments. Public awareness increased due to publicizing the health issues of lead exposure. Then, a working group of people gathered to replace all the lead piping for those affected by lead exposure. Public health nurses can advocate for community members by lobbying for the replacement of lead-based pipes in their community. Surveillance of potentially affected population groups will also assess where the problem exists. Screening for the blood lead levels in children at routine well child visits can also be initiated. Educating community members on flushing their water systems in the morning is also a short-term solution to the problem. Finally, informing patients on local elevated levels of lead in water supply is important. These patients should be instructed to only use bottled water for drinking purposes.